Welcome everybody to the Help for Hip Dysplasia podcast. We are lucky enough this week to have a special guest in from the professional side of things. We have Shahrzad. She is a biomedical engineer joining us to talk about all of the aspects of replacements and some of the surgeries that we're going through. So welcome Shahrzad. Thank you so much for coming on.
Thank you very much for having me.
So I'd love us to just get kickstarted by just asking a little bit about your background, what kind of brought you into this area of the medical profession. What drove you, where your passion lies, and just kind of take us up till there for the moment, if that's all right.
Yeah, definitely. Thank you. So, I guess from an early age, I was always interested in STEM, science, engineering, technology, and all of that when I was a student at school. So it was kind of, I was showing that I would be choosing a path in engineering. But then because of my family background, I have relatives. My father is also a physician. I think that's what guided me to pick biomedical engineering. I've always been passionate about helping other people, making a difference. My goal was always to study something, to do something meaningful, especially when it comes to medicine and patients and doctors and people who, patients specifically are in pain, they need more attention. And I've always wanted to impact the community positively. And I guess that's how I chose to become a biomedical engineer. I have a bachelor's degree and a master's degree. My master's is from Leeds University in the UK. And yeah, so it's master's in medical engineering. And then after that, just several years working in the industry of orthopedic implants mostly.
And obviously there's many different areas that you could choose to specialize in, right? So I think your specialty is hips and knees. Can you tell us a little bit about why you chose those areas?
Yeah, definitely. So I guess it was just an interesting topic to me. When I was studying at university, I came to know more about joints in general, and then the load transfer in joints and between muscles and joints, and how muscles pull and make movement, make humans moving is enabled by all of that. So I think that's what I was originally interested in the topic.
Do you ever have any sort of patient contact? Are you more the research side? Are you more like the design side, the putting it all together, like, or a little bit of everything?
Um, you could say a little bit of everything, but now currently, most of my dealing with joints is with retrieved or explant joints. Those that are taken out of patient body, we study them, we try to understand what the root cause of failure was, and that side of things. So if I were to talk to you, one-on-one about joint replacement, you would hear too many negative information because that's my day-to-day job, because I just
Yeah.
look for problems with these implants and how they failed and all of that. Having said that, joint replacement, especially hip replacement, is the operation of the century, is the best thing ever. They rarely fail, like, I don't know, like 5% of the time they fail. But then we are focused on that 5%, which is not the best thing when it comes to me talking about joint replacement. But having said that, we do have some dealings with patients in cases like a, a legal situation. After a hip replacement might fail, we may come to conclusion that maybe there was something that could be avoided. So the patient then talks to us, they get involved with solicitors. And in that sense, sometimes we have dealings with patients, but generally, no, just the implants on their own.
Cool. There are a couple of questions that I might come back to about that, because that's not something that I realized you do. So my brain is kind of going into overdrive right now thinking about some of the questions. But I'll come away from that first, and then we'll perhaps just ask a couple of questions about that at the end. Okay, so when we're thinking about a replacement surgery, I guess if I'm thinking from maybe some of our listeners' point of view and the the whole procedure about getting involved with having a replacement, so a hip replacement in our case, the whole process, one deciding when to have it done, to then deciding which approach is going to be done, what materials are used, what type of socket, how much of the joint is going to be replaced. Is it just the socket? Is it the ball? Is it a combination of both? And yeah, there's so much to think about. So do you have a bit of a sort of guideline for how those things are determined, like the shape, the size, the materials?
Yeah, definitely. There's a big chunk of little details that come together and make this successful hip replacement. So in terms of how the implant, the specific design or the specific material is um, being decided for a particular patient, I would suggest that any individual, as the patient, uh, do their research, study about implants, just try to have a basic understanding of the implants, designs, materials, really basic. I mean, like a simple Google search. That would help you to have a better connection, better discussion with the orthopedic consultant. And then I think the decision has to come from both sides, from the surgeon and the patient. And yeah, so the implant that is used for hip replacement, it depends on several factors what implant they're going to choose. It can be like patient factors. It depends on whether the patient is very active, not so much active, what's their age, what's their BMI, like the weight and height and all of that, what's their activity level, what other it's called comorbidities, so what other serious health issues do they have or not, and what's the background, is it their first hip replacement, is it a revision hip replacement, all these little details can impact the decision on what implant is most suitable for that patient. And yeah, so this is this is why I always suggest that people do their research before talking to a surgeon. And even after talking to the surgeon, if you're not too sure still, you have more questions, ask for second opinion, go to another surgeon. I mean, yeah, just as long as you're transparent, you just ask all the questions you have. And then the surgeon should be happy to, answer them for you, to just make sure that you're happy with their decision. Yeah, it should never be a one-way, discussion. The doctor would tell you what they're going to do and you just accept it. It shouldn't be like that.
Thank you for saying that. It's always it's probably very reassuring for people to hear that there are other people in the industry that are like, no, it is a two-way thing. Like, please ask the questions, because I think sometimes still, unfortunately, people can still feel a little intimidated in these appointments, just because sometimes there's a bit of either a power dynamic, or there's not enough time and people are feeling like they're rushed, and that it's inconvenient to ask more questions. And the more people I can get on this podcast to say, no, ask the questions, like demand that time, is amazing, because it's something I'm really trying to sort of advocate for. So thank you for that. And it's also really reassuring to hear that you're saying it really is considered, like, who you are as a person, and yeah, down to which materials are used and which type of replacement you're going to get, because it's such a massive consideration, especially in the hip dysplasia community. It comes up as quite a common question, because one of the most heartbreaking things that I hear so much is that there are people in their 20s, 30s, 40s, 50s, 60s, whenever they're having it done, that are being told that they're too young to have a hip replacement done. And I think it really kind of messes with the psyche, because you're like, well, I don't have a good quality of life, my function of life is impaired, but I'm too young, so how long do I have to suffer for? This is something that I brought up in the last podcast, and there's going to be a group discussion podcast coming up soon about people of, you know, a younger age being given different bits of advice. So when people are, let's say, you know, being of an age that they're told, oh, surely you're too young to have a hip replacement by other medical professionals, friends, family, whoever, what extra considerations are then made by people like yourselves or the consultants for those things? Like if someone's in their 20s and they're getting a hip replacement, no, I don't think any hip replacements are designed to be replaced. I don't think the intention is ever that it has to be replaced, but or revised, I think is the better word. But is that considered from day one, depending on people's age?
I mean, like you said, the intention is for that joint to last forever for that patient, you know, to live beyond what patient is living. So that's the ideal situation. So you don't need to revise it at all. But unfortunately, with joint replacement, hip replacement, it's yeah, if they do like, I don't know, something like 20 years, that's good. That's, you know, when you have a young patient, you know that at best in 20 to 30 years, they would need a revision surgery. So if the patient is like, I don't know, 40 years old, 30 years old, that's, you know, that's eventually going to happen. But the thing is, yeah, unfortunately, they do fail. They do last, most of them do last a long time, but we have seen cases that after a few months, because of complications, rare cases that patient didn't actually follow the orders, like don't do certain kind of activities. They did, and it dislocated, and that was a trauma revision surgery. But yeah, I would say that because we know that sometimes joint replacements don't last long, maybe that's why the surgeons don't want to do it for a younger patient. Having said that, there is another option, hip resurfacing. So in hip resurfacing, a smaller amount of bone is removed, like only I actually have a picture here. Is it like, yeah, this one to the so here you can see a replacement, and next to it is resurfacing. Only the surface of femur, the head of femur, is replaced with a metal component that just grabs the surface of it, and on pelvis as well. It's a very thin just bearing that is implanted. So that's one option for younger patients who are more active as well. For example, the tennis player Andy Murray, he has one of those, and he's just doing excellent. So that's a very, very good, you know, success story in that sense. But yeah, again, it would depend on the patient's, you know, bone quality, weight, and all of that. So yeah, I mean, it may be best to double check that with a surgeon, but my understanding is because joints sometimes don't last very long, that's why the surgeons try to, you know, avoid having the operation on younger patients, which is not ideal. Definitely not if the patient is in pain. It's not good, but you know.
So I think that's a great thing for people to hear again, is that it's just worth asking the question, because it might be that, you know, the go-to is a replacement, and it's worth asking the question, is a resurfacing something that could be considered for me? If it could be, great, let's have a chat. If it's not, why? It's just asking the questions, isn't it? And kind of getting curious about which things are and aren't relevant. So yeah, that's really cool. And yeah, obviously Andy Murray is, I was going to bring that up as well when we were talking about resurfacing, and there's a documentary, isn't there, about his resurfacing, that's always really interesting to dive into if you haven't seen that already. The next thing about that I was curious is that you did an Instagram post a little while back, which was really cool, but it listed like all of the materials that can be used. I think it was like the head of the femur, and you had this little ball, and you were like, these are all the different types of things that are included in this, and it just made me think, wow, that's a lot. Like, are people allergy tested before they have a replacement done?
Very good question. And again, this is my understanding. My understanding is that the answer is no. It is not mandatory to test for metal allergy. It is recommended to patients if they've had experiencing metal allergy before, like with a piece of jewelry or anything like that, that it is recommended that they share that with their surgeon and then maybe take it from there for any tests.
So what about custom replacements? Because this is something that I'm very curious about from both a personal and professional point of view. I've been told that my replacement will be a custom one, but yeah, what extra considerations do they make for that? And then, do they mold the parts to your hip? Is there 3D printing involved? Like what goes on there?
Yeah, that's a very good question because this is relatively new. I don't think I've had any explants that were custom made yet. So because they're made only for that patient's anatomy and all of that, I expect those implants to be performing best for that patient. So it's very good news that I haven't seen any of those yet. So in terms of manufacturing of these implants, yes, so they do use additive manufacturing, which is 3D printing for these implants. There are other methods as well. They're a little more expensive, and they take time. If it's a case of trauma, for example, it will be really challenging to prepare one of these custom implants like almost immediately. What they basically do, there's no molding or anything like that. They would just take medical imaging, like mostly not x-rays maybe, but CT scan of the joint, and then on that model they would acetabular component and the femoral component, and then put it together on that model, make sure everything is absolutely perfect, and then go through the process of 3D printing. So yeah, it's a very, very good option. That's the best hip replacement you can get. It's like a metal version of your own hip. So so that's very good.
Amazing. Okay, cool. So yeah, the thing that I was going to come back to now is something else that I saw recently on your Instagram, which is the dual mobility cups. Now, I think you said this isn't an area of specialty for you, but I just wondered if you might be able to give us a bit of an overview as to what that is, because I think that's something that's relatively new.
It is. And yeah, so the idea behind the dual mobility cups is that they try to eliminate dislocation. So with hip replacement, there are certain failure modes. So one of them is that the head gets dislocated from the socket. And that's a very, very painful thing to happen as well. The other thing is like something like loosening when the bone around the implant is basically like dissolved, like disappears because of the metal debris, because of all of that. The reaction is that the bone just starts to dissolve, and then the implant would get loosened. There's infection, there's response to metal debris. So all these problems, one problem at a time, the scientists are trying to tackle them. So this dual mobility is for dislocation problem. It appears to be, showing good results for that particular failure mode. So how it works is, so I have this picture right here. This is a dual mobility cup. So the idea is that there's a metal shell that sits in acetabulum on pelvis, as any normal hip replacement would. And then the yellowish component, the plastic component, rather than plastic component fixating into the acetabulum or acetabular cup, it would articulate with it, like make a bearing surface. So that's the first bearing surface. And then the head, the pink component in there, that's the femoral head. And then that's again as normal. Femoral head would be articulating into plastic component in hip replacement, standard hip replacement as well. But the difference is there's one articulation between the head and plastic and another between plastic and metal, which makes it dual mobility, which makes it, have a better range of motion. I wouldn't dislocate in that sense. I haven't seen any of them come through to me again. That's a good thing because I just look at failed implants. So yeah, so it appears to be doing fine, but just because I haven't seen one in person, I don't really know much about the implant itself.
So how long have they been around? How long have they been in the mainstream after sort of research trials have finished and everything?
Um, I wouldn't be able to give you an exact date. I would say around maybe 10 years or something.
Oh,
But
really?
yeah, relatively new, but again, I'm not too sure.
Okay, because yeah, it's something that I don't hear a lot about still. Even sort of being in this, it's such a niche area, but still, you don't hear a lot about it. And so yeah, I was just curious as to why. But the fact that the dislocation thing is such a big part of it really makes so much sense.
Yeah.
It kind of brings me to a question that I hadn't prepared for, but just kind of wanted to maybe throw in there, if that's okay. It kind of relates back to surgeons' protocols, because I think sometimes, we get given these protocols and we're like, we shouldn't bend past 90 degrees and we shouldn't twist and we shouldn't, there's certain things that we're told that we should and shouldn't do. And these things all vary slightly, surgeon to surgeon. But I just kind of wanted to bring that back to there are reasons for the protocols that are linked to the type of replacement that you've had or the positioning that's been put in place. So yeah, I was just wondering if you could maybe just embellish on that a little bit about the protocols and how they relate to the design.
Definitely, yes. So as you mentioned, all the do's and don'ts after joint replacement, there is a reason behind it. So for example, you mentioned like twisting the leg, like internal rotation or external. That again directly links to hip dislocating, or like they say that you shouldn't be sitting lower than where your knee level would be, especially the first few weeks or maybe the first couple of months. The reason being, after hip replacement, it will take a while for the joint, for the soft tissue around the new joint to, get strong, the scar tissue develop, for everything to fit together again. Because after surgery, everything is on stitches, things are not back to the way they used to be. So in that sense, for the first couple months, the surgeon would need the patient to follow the rules really carefully, just to eliminate the risk of failure at an early stage. Even with taking care of the wound not to get infected, all of that. That's it. It's really to benefit, to patients benefit as well as surgeons, obviously. But yeah.
Brilliant. And we've touched on that again about sort of making sure that the joints last and it's all effective. I was just wondering if, bring it back to what you said that you do, you work with and you investigate why some of the failures happen. Is there any kind of general guidance that you can give from your experience?
So check your genetic test for metal allergy. That's one thing. The second thing is follow the orders of the surgeon. Whatever booklet they give you, just study it. So if you feel that the joint is painful after surgery, sometimes you can tell something isn't right, but the doctor will tell you no, everything is fine from what they can see. Ask for second opinion. Sometimes, in some cases, the second opinion helps with finding the reason for the problem. Don't just, you're trusting your surgeon and that's fine, but they can miss something. So yeah, just that second opinions.
See, second opinions, third opinions, ask all the questions, advocate for yourself, ask for that extra few minutes to ask the last couple of questions on your list. Yeah, that's so cool. So you did say that there was like, if you wanted to do some reading, like there are some things that you can just kind of Google about the different sort of replacements and stuff. But I wanted to ask you, I also spied on your Instagram. I did a little bit of Instagram stalking before we before we got a chance to chat, I noticed that you have a book that's going to be re-released very soon. So yeah, would you mind telling us a little bit about that? And is that going to contain maybe some of the information that would be useful for us to be reading for those of us with hip dysplasia?
Definitely. Thank you for bringing that up.
You're welcome.
So yes, I released my book, Wee Tips on Knees and Hips. It was released in 2020, but every year I take it down, review, make sure everything is up to date, add a couple bits to it, and release it again. So it is currently under review, but it should be released in the next couple of days. So yes, I would recommend everyone to read it, just because I'm expecting it to do this, but I hope it does. So it's designed to give everyone, patients, caregivers, everyone, a basic understanding of what joint replacement is. So there are like 5 chapters. The first chapter looks at the history of joint replacement and why do we see an increase in both hip and knee replacements during the recent years, and it's expected to go higher. Then chapter 2 is focused on hip replacement. So everything about the design, everything about the materials, everything about primary revision surgery. Yeah, just a basic understanding of what each component is. The third chapter focuses on knee replacements, total knee replacement, partial knee replacement, all the materials, all the different designs. And then chapter 4 takes you through an imaginary procedure, like from like, I don't know, 2 weeks before your joint replacement until a couple months after, what to expect, how to prepare, how to deal with problems afterwards, if any, like mental health and all of that. And then chapter 5 is just appendices for some useful information. So yeah, I would highly recommend everyone to read it. It's just gives you some, some basic knowledge of what to expect from your joint replacement as well. Yeah, I'm currently also working on a journal that's specifically designed for joint replacement patients. I'm hoping that this will help patients, record their progress, even start before the surgery, because sometimes, with the painful joint, you can't do certain things. So you might ask your surgeon, oh, can you just make the pain go away so I can do my walk, my half an hour walk every day? And then after the surgery, after a while, you get used to the new joint, and you go back to your surgeon and might ask, oh, when can I start playing tennis and things like that. Try to manage your expectations, I would say. So that will come later this year. But yeah, definitely my book, Wee Tips on Knees and Hips, is available on Amazon. Yeah.
Amazing. So I am definitely going to be keeping an eye on when that journal comes out as well, because journaling and keeping a track of your symptoms and your day-to-day feelings, and the way that it affects all of the different areas of your life, not just about your pain, right? It's about every other area of your life. And through so many discussions recently, it's become more and more common that I'm realizing that people's hip pain affects every single part of their day and their life, and to actually take time to think about something that doesn't involve their hips at all is sometimes very, very rare. So to be keeping a track of these things, to understand which parts of your life it does affect, and then be able to do a comparison before and after, and just kind of ground yourself in how you were feeling before. Because I think you're right, sometimes it's easy to forget how difficult things were, and it's like, okay, well, I want to be doing that now, and that now, and that now, and that now. And you might not have been able to do that for years and years and years before. And we definitely don't want to write off the ability to do these things. But like you said, it gives us some grounding, and it gives us some perspective. And it gives us the way to then be able to pace, or to ask the right questions, or to get the right support from the right people, to kind of give us a more realistic timeline. Because I think we always want to be the best versions of ourselves, but we want it now. So yeah, that's awesome. I'll be really, really looking forward to that. So thank you so much. too many questions to go into, I think, about the explant research that perhaps we can go into another time, because I'm aware of your time that you've got available today, and so we'll start wrapping up. But yeah, so many more questions that I'd potentially like to pick your brain on again another time if we may. But yeah, so if there's any other little sort of snippets of information or wisdom or guidance that you can give anybody, is there anything else that you'd kind of like to finish off with?
Absolutely, yes. So it's just one thing that I would like to remind everyone that if you go ahead with a hip replacement or any joint replacement, and it turns out more difficult or challenging than you had expected, just know that you're not on your own. Like I said, I deal with failed implants, and it's like what 5 to 7% of all hips fail in total. But that's still in comparison, in the scale of things, 100,000 people go through with these joint replacements, and like 5,000 of them have challenges, problems. So you're definitely not on your own. Reach out to people on Instagram, Facebook, wherever it may be, and just share your story and hear other people's stories and how they tackle problems. And if you have to go through with a revision surgery, just know that revision surgeries in general are a little more tricky for the surgeon to manage whatever was done previously and try to improve it for you. So expect that. And I would highly recommend that if you go ahead with a revision surgery, send your original implants for analysis. So I didn't mention this, didn't actually get a chance to mention it, but there's a implant analysis service provided by the NHS in the UK. So yeah, so all you need to do, just reach out to your surgeon and just ask them if they can send your implant after extracting, after removing from your body, to be looked at by NHS implant analysis service. Again, there's a brochure I can send you the link for, Laura, and yeah, that is very useful information, because you don't know what the outcome is, you don't know what you will see in that report. It can be some useful information there.
That's amazing. Yeah, I didn't know that service existed. So yeah, that's opened up a whole world of
Definitely.
questions and reassurance for people that, okay, well, I've had a revision done, and that's going to give me so much more information. So it's either going to help me understand how to look after it better this time, if there's something that we can be doing from our side, but also to know if there's anything else that's different that could be useful for us to know to preserve the longevity, and whether that comes from the side of the health professional or the patient. Like you said, it's a team thing, going through a hip replacement surgery or a knee replacement, any replacement surgery. It's something that we have to work on together. And you said it's not a decision that comes from the consultant. Every part of you as a person is considered. Every material that's used, the size, the shape, the type of surgery that's done, it's all tailored to you. So I would probably just pop in there that if you're not feeling like your consultant has considered you as a person, as an individual, they haven't asked the questions about your personal life, like your goals, what your work is, what your hobbies are, what you plan to do with the rest of your life. Like, if they haven't considered you as an individual, and you feel like they've looked at your scans but not got to know you as an individual, then perhaps that might be something that's either worth asking them why that hasn't been asked, or is there a reason that we haven't had this discussion, to give it either that chance to have the discussion, or if you just don't feel like you're connecting with that consultant, that surgeon, perhaps it might be worth getting a second opinion in that situation. It's probably putting you on the spot a little bit to ask you whether you agree with that or not, but I'm going to do it anyway.
No, definitely. Yes, you mentioned the word connection. That's definitely, yeah. So yes, you should have a certain level of trust and connection to your surgeon. Yeah.
Right. Sorry for putting you on the spot there.
No, that's fine.
So yeah, we'll wrap up. there will be so many more questions that I'm sure come in off of the back of this. So yeah, I'll wrap this up now, but potentially we'll be able to speak again for a part 2 or something. It would be really amazing to have the opportunity to speak with you again. I will put the links up for your book, for the metal allergy testing link that you're going to send as well, and this amazing diagram that just kind of explains a little bit more about the body's reaction to the implants that are going in. If people wanted to follow you on social media, where could they find you?
Yes, sure. So I have my Instagram account. So it is Shahrzad _biomed _eng. So that's Shahrzad Biomedical Engineer. So yeah, I wrote it here. I don't know if it would be visible when you share this podcast, but not. Anyway, the other one is my page for my book on Facebook, which is called We Tips Book. So that may be easier to find. Yeah,
Perfect. Thank you so much for your time today. It's been so interesting and really useful. I hope people find it reassuring to hear some of the things that go on sort of behind the scenes, all the things that are considered, and that it gives people more incentive to do more reading, ask more questions, develop a list of questions to take in based off of some of the things that we talked about today. And again, I'm sure that there would be a lot of questions raised and that people could take in by reading your book as well. So yeah, I'll put the links for everything in the descriptions on the audio and video version of today. But yeah, thank you so much for your time. It's been really wonderful speaking to you.
Thank you very much, Laura. Thanks.